year novice nurse anesthesia students enter the clinical arena, and their first task is mastery of the anesthesia workstation setup. The expectation is to take information taught in the classroom and in simulation lab and put to use in clinical practice.
Quickly, novice anesthesia interns are expected to independently execute anesthesia workstation setup. Nurse anesthesia students are under the same production pressures and work environments with rapid turnovers, just like experienced anesthesia providers. Inexperience, coupled with the fast-paced, high-stress environment, creates a situation where critical elements of the setup could be omitted. Traditionally, mnemonics such as Miss Maid or Sam Tide have been used to aid new providers during setup of the anesthesia workstation. These memory aids are used to assist in recall of a multitude of items vital to the delivery of safe anesthetic. The problem with the use of mnemonics is they do not mitigate memory inaccuracy or distractions that could occur during setup, which could result in omission of critical elements of the workstation setup. The Agency for Healthcare Research and Quality defines a patient safety checklist as an algorithmic listing of actions to be performed in a given clinical setting, the goal being to ensure that no step will be forgotten. In 1993, the pre-anesthesia checkout was developed by the ASA to ensure proper functionality of the anesthesia equipment prior to the administration of anesthesia. Incorporation of this checklist is associated with a decreased risk of severe postoperative morbidity and mortality.
Multiple industries that are known for their strict adherence to safety procedures, such as aviation, nuclear engineering, aerospace engineering, and healthcare, utilize checklists as a mandatory safety measure. Checklists reduce the need to conceptualize and recall information and are developed to reduce human error. Since thorough preparation and complete room setup is necessary for the safe delivery of anesthesia, in the effort to aid new nurse anesthesia students with proper room setup and with the goal of decreasing the incidence where components of room setup were omitted, the ASSIST tool was conceived.
ASSIST stands for Anesthesia-Specific Student Intern Setup Tool. The tool was developed utilizing suggestions from practicing CRNAs, items from Mnemonics, and the 1993 FDA checkout. The tool includes airway setup, suction, medication dosage, and syringe labeling, items for safe patient positioning, monitors, and miscellaneous items to aid novice anesthesia students in preparing for each anesthetic. Student nurse anesthesia interns entering clinical experience in June of 2018 were given the tool to guide setup of the anesthesia machine and workstation during their first clinical semester. At the completion of their clinical semester, students were asked to complete a questionnaire regarding the ASSIST device. To determine if a problem with workstation setup existed among students at the Millikin University and Decatur Memorial Hospital Nurse Anesthesia Program, clinical evaluations from the class of 2017 Clinical Practicum 1 were reviewed. Handwritten comments from the CRNA clinical preceptors regarding omission of any item listed on the ASSIST device was counted. There were 8 omissions found during Clinical Practicum 1 of 2017. After implementation of the ASSIST device, 2 omissions were found upon review of the student clinical evaluation forms from Clinical Practicum 1 of 2018. Follow-up with those students found the students did not use the tool to guide setup that particular day. The ASSIST device is an easy-to-use tool that has shown to help decrease omission of critical elements of the anesthesia workstation setup. Implementation of the ASSIST device among nurse anesthesia students demonstrates a positive impact on patient safety. The ASSIST tool was easy to introduce into clinical practice. The information on the tool is generalizable to most anesthesia setups experienced by students across all clinical affiliations. This tool could be easily modified to conform to the processes of any anesthesia department.